I was diagnosed with relapsed remitting MS since September 10, 2007. So in September, it will be 10 years. I started treatment with Copaxone for the first few months, and in January 2008, my doctor switched me to beta-seron. Well, the treatment that my physician gave me has been working very well, even better than we expected. Well, the most recent MRIs that were just a couple of weeks ago have shown that some lesions in my brain, neck, and spine have been disappearing. We were not aware that lesions could disappear. I thought they would either be shrinking maybe, or they could be in remission, but we did not know they could disappear. So this is excellent news. In the beginning, it was devastating. I think I cried for maybe a month because I didn't know what to expect. And actually, I turned a job down because I didn't think I would be able to work. But after that first month, I never cried again. And actually, once the initial symptoms were gone, I never had a relapse. And for people who are newly diagnosed, I would say to stay positive and don't give up. I think part of accepting it is to stay positive and go on with your regular life. I think positive thinking definitely helps. And talking with your doctor, getting on medication that works for you. And I would just say don't let it control you. Just go on with your life and cry it out like I did, and then stop. Don't continue crying. It's not the end of the world. I know they've come out with a number of oral medications, and I'm not really sure of their success rate. The way my doctor and I feel is if you find a medication that works for you, you stick with it, which is why I'm still on beta-seron instead of one of the newer medications. We don't want to switch on something that's already working. So you have to kind of decide with your doctor what works best for you. And as much as I'd rather take a pill than inject myself, I'm going to stick with what works for me. And this is really working on a level that I didn't think possible. So I'm hoping that they would do more research into why this happens to be working so well. The reason I decided to come in to plasma research is because I wanted to donate blood towards the research on MS. My experience at plasma research was a positive one. Everybody on staff was very nice and welcoming. The phlebotomist was a great guy, didn't hurt at all. And I just liked everybody. They were very nice and welcoming, and I would do it again.